Hello everyone. This video is about documentation. I will introduce myself. I am Mrs. M.Madhubala. I am working as a nursing tutor in E.S College of Nursing. I will start the session documentation. Documentation is very important in nursing. What is the documentation means? Is a record of the care a patient receives from a nurse or other caregiver, and it's a key part of nursing practice. Documentation is a very important one, and it's a key part of nursing practice. What is the definition means? It's a written or electronic record that includes information about the patient's care and their response. It includes the patient's care and also the response. And what may be the purposes for this documentation means? First one, continuity of care. Documentation ensures that care is consistent across shift and healthcare team members. Second one is quality assurance. Documentation help monitor standards of care. And reimbursement. Documentation provides information for insurance companies and Medicare and Medicaid to reimburse the care. And research purpose. Documentation can be used for research purposes also. And legal concern. Documentation may be used in legal proceedings. It will help for the legal authority. And patient assessment. Documentation helps nurses assess a patient condition and make appropriate decision. And nursing diagnosis. Documentation is an essential step in the nursing process, and standardized terminologies are used to document nursing diagnosis. And patient needs. Documentation helps determine and evaluate the needs of individual patients. Next purpose is quality of nursing practice. Documentation can be an indicator of quality nursing practice and patient mortality. Communication. It's a primary form of written communication between the nurses and other healthcare providers. And next we'll see the types of client's record. There are so many types of client's record is there. First one is patient medical history. What does patient medical history mean? It's a summary of a patient medical history. It includes allergies, what we have given the medication, and what are the surgical history, and what are all the past treatments. This it's all include in the patient medical history. And second one is medication administration record. It track the dosage, route, time of administration, and patient response to medication. And third one is communication logs. Document interaction between nurses, patients, and other healthcare providers. And patient care instructions. It includes directives and educational efforts from healthcare providers. And record keeping forms. It includes admission form and nursing care pen, NCP. Nursing care pen is otherwise known as NCP. NCP means a clinical document that records the nursing process for a patient. NCP means nursing care plan. And next one is progress notes, a record of nursing action and observation that helps nurses monitor the course of care. And next is flow sheets, a simple form that gather important data about a patient's condition, it including medication administration records and graphic records. And next is discharge summary. Completed when a patient is being discharged, and it includes instruction about the medication, diet, and food drug interaction and follow-up. And next we will see the guidelines for nursing documentation. The following tips, recommendation, and best practices can ensure your documentation is precise and useful as possible. We want to follow this following. First one is, we want to follow be accurate. Write down information accurately in real time. Inaccurate or misleading documentation is unethical and it can harm the patient. Second one, avoid late entries. Yes, late entries can introduce inaccuracies. If you have to document something after the fact, follow your employer's late entry policy and clearly mark its a late entry notations. And next is follow policy on abbreviation. When you use abbreviation, be sure there are standard for your employer. Okay. And document physician consultation. Document all the parties consulted during the patient care, it including names, times, responses, and any resulting actions. And next one is chart the symptom and the treatment. Make sure you document both the symptoms and the treatment you are administered to address it. And avoid opinions. Don't write down your opinions. You confirm and write it. And next we will see the do's and don'ts in nursing records. What all we want to do and what we want to avoid. So first we will see do's. So these are all the things we want to follow during our documentation. So what we want to do means, before entering anything, ensure the correct chart is being used. Yes, we want to check in between. We are using the temperature chart. If we are going to measure the temperature, we want to check whether we are using the temperature chart or not. And ensure all documentation reflects the nursing process and the full extent of your nurse's professional capabilities. And always use complete descriptions. Chart the time medication was administered and administration route and the patient response if any other allergic is happen. And chart precautions and preventive measures used such as bed rails. Record any phone call to a physician including the exact time, message, and what may be the responses. We want to record this all. And if a patient refuses to allow a treatment or take medication, document it and be sure to report to a manager and the patient physician. Yes, you want to report if the patient is refusing to receive any treatment. You want to report to your physician and also the manager. Always chart patient care at the time you provide it. It is too easy to forget details later on. And if something needs to be added to documentation, always chart that information with a notation that it is a late entry. It includes the time and also the date. Always document often enough and with enough detail to tell entire story. And what all we want to don't follow, that means don't chart your symptoms such as complaints, C/O, complaints of pain, without also charting how it was treated. And never alter your patient's record, that is a criminal offense. And don't use shortened or abbreviation that are not widely accepted. And don't write the imprecise description such as bed soaked or a large amount. So don't use this type descriptions. And don't chart excuse such as medication not administered because it was not available. So don't chart these excuses and all. You want to avoid that. And never chart what someone else said, heard, felt or experienced unless the information is critical. If absolutely needed, use quotation and properly attribute the remarks. Never chart care ahead of time, as situations often change and charting care that has not been performed is considered fraud. Thank you for your listening.